Sioux Lookout First Nations Health Authority, or SLFNHA, presents SLFNHA Radio Connect, building strong connections with communities by sharing who we are, how we can help, and the services we offer. Wiindamekewinan, Sioux Lookout First Nations Health Authority Gajgadig, Egochke Eskam SLFNHA Visionkade. Miwa Kegunenan, Iwanun Keguns Wichi Guyagban, Ima Ishkunaganang Kazgabeshig, Egochke Iwanun SLFNHA Wiindamekewinan. Greetings. My name is Charles Mikas, and I will be your host today. I currently work in the Wiindamekewinan department at Sioux Lookout First Nation Health Authority. And I'm originally from Sandy Lake First Nation. I've been with the organization now for about 8 years. Bozo wajigidna egama ngagaku gajmawe oguma kegunenan iwenun akuziub mujigonan imanike Sioux Lookout First Nations Health Authority. Welcome to today's program. We're excited to have Ariel Root and Shininio Nanandawik Kendamoan, Program Manager from the Health Services Department at the Sioux Lookout First Nations Health Authority, with us today. The Anishinaabe Nanandawik Kendamoan program is the research program at SLFNHA, also known as the Sioux Lookout First Nations Health Authority, and loosely means to seek the ways of knowing or understanding of the Anishinaabe or Anishinaabe. Today we'll be speaking with Ariel about the research program and what types of work they have going on. Welcome, Ariel. Miwag tsibuzo gudnguna nomagijik. Migwets gudnguna maga bizindamig. Maajugun jikandamin iwe Ariel Root is nikazo. I think and Shininio Nanandawik Kendamoan Gajinkadeg and Kiiwetinoong. Iman ke I think Sioux Lookout First Nations Health Authority. I think Shachis Jgade iwe Health Services Department iwe Gananandawik Kenjigadeg Kegun. Ego miwe Wenjijin Kadeg and Shininio Nanandawik Kendamoan. Enanandawi Kenjigadeg iwenun anin Kegunjwichin Daban and Shininwag ego and Shinabeg. Miwe ahi abadak ahi gajgadeg awyagana nan daumund egochke anin kegis munsenung ban kawichin zawyaga akhuz miwe gajgadeg ego Ariel Root miwe nun ugawista dazandan no magzich miwe ksimigwatskinu Ariel.
Miigwech for having me today. I'm excited to be here with you, Charles.
Thank you. Wiindamekewinan gagishgak. Nanjikkendan Wiindamekewinan nongum gagishgak.
We've all heard of research. Maybe we've been asked to be a part of a research project, asked to fill out a survey, or asked to participate. Tell me, why does SLFNHA have a research program? Kakana idugawya as a ogi kendan nandatsuge eguidan khimaj awya iwanun gananando kendangegunan gediskunganang. Kegunan niwe gajgadig research project gajgadig miwe gananando kendamajgegun. Ego as a idugegin gikogajmugo. Kegunan dasiwe gajgadig. Kegunan ganando kendamaj.
I think in part because of just that. Communities are often approached by universities or private organizations asked to participate in their research projects. Some of these experiences have been positive, but many people have shared negative experiences of researchers traveling to community, asking questions, getting information or data, leaving, and then never coming back. So part of why SLFNHA is involved in research across the region is because we want to help communities be part of research projects they're interested in from beginning to end, and for communities to be considered an equal partner in those projects. By this, I mean the project is designed to include local ways of collecting data, language, and culture, and that researchers are accountable to community to share back information in ways that the community wants or prefers. The other part is that communities have been doing their own research for decades, and they're aware of how important data is for program development, reporting, funding, and advocacy. In 2012, the SLFNHA Chiefs and Assembly passed a resolution to develop a research unit that would, in part, provide health data and evidence to support and advocate for delivery of appropriate, adequate, and proactive health care. Part 2 would be to have a program that's based in community-set research priorities. And the third part of that unit would be to support access to health research data that would be owned by community. Ultimately, the intention of having a research program at SLFNHA is to support projects that are of interest to communities, will provide health data that's important and relevant to communities, and support communities and research partnerships with which they want our help.
Apunak machino ubanas kagoan kichi skuni wakamagunne nanda wemstugoziwe unachigewanan. Kagwechimendo chiwid stuat unananda kenjigewanin. Anda minusenuan sagod machine inachimuak unananda kenjigen pijanit kagwetwenit kegonan huntinama wawat udkadonanin mina ezinepitsimachawat. Midashowe Sulakaut First Nations Health Authority kawanchi nanandawe kekenjigej ewi wijhangato abuwanak chiwijtuwat Mekewinan ka andawentamu wat ke wichiguat mina apuanak chikikaninto huwe is chigewanik. Huwe anukiwan is chikate chikikinikatenik anishinane ogkentamawan. Kasha mamo shakinaket utisikiswewan mina utinatisuwan. Mina okakwetwek chipe Kiiwetinoong Wiindamekewinan apewinan kasi andawentaminich. Apewinak asa misino midasyake utonche pitutanawa nanandawik kenjigewinan kewinawa. Mina ogkendanawa pitenda kwanik kendamawanene uske wichiwewen kawi unachigadek tepato chikewen shunya pagitanigewen mina kanochike tamagewen. 2012 okamahkanak ka mawat hituat oki sabunanawa anukiupeban Sulakaut First Nations Health Authority chuunasaj onanandawik kenjigen ke basic pagitanang akusiwe kendamawanana mina kashe nagwak gagwetwewenink mina chikano tank akusiwe wichiwewenan ke menuskagut ke debset mina menusahigut nishin apewen ka is unahtot nanandaw kenjigewenane nessen owi chika pawistan akusiwe nanandaw kenjigewenane che tepenawe wazat apewen kawanche andawen chigatek nanandaw kenjigewen Chipimo Witot Sulakaut First Nations Health Authority Chiwinche Weed Storch Anukiwinan apewinan ka misawentamanit. Se minat akusiwe kentamaunene ke wit hikunet mina Kiiwetinoong kimat apewinan nanandawik Kiiwetinoong.
That's great. So sounds like the research program at SLFNHA is trying to strengthen community governance, or in other words, oversight and direction of research projects in which they partner. What are some examples in how SLFNHA does this? Mia maujugumuntaganiwe kagwe pamujigadegiwe nanandawi kendamon chigi unendamapan ishkuniganan and kenis pamujigadegiwe and Kiiwen gajigadik maujugu andawendawan anshinwagwinwa ago anshinabeg Wiindamaj anin gen yaisagan iwenun and Kiiwen gab mujigadik.
For the overall research program, we have a research advisory committee that helps us make sure that the ways in which our program approaches projects are informed by community culture and practices. Sometimes we seek advice from this committee when we're asked to partner in a new project with a university. So we would bring a new project to the committee and say, hey, here's a topic or question that someone is interested in. Are you? Is your community? What do people think about this project? We also provide updates about our findings from ongoing projects, and sometimes when we are working on a project and feel stuck or have a problem, we can ask this committee for guidance on how to move forward. The committee has membership from different communities, but members do not necessarily have or need to have any training or formal education about research. We're always looking for more members, so contact me if you want more information. We also identified 5 research priority areas based on feedback and input from community and tribal council members. Drinking water, foods and nutrition, maternal and infant health, traditional practices, and substance use addiction and mental health. These areas can help us prioritize projects since we know communities have expressed an interest or need for research in these areas, but we can also work on projects that do not fall within one of these areas.
Nanando Kiiwetinoong Wiindamekewinan dayawamen Wiindamekewinan apuwaka Wiindamekewinan kitchinach ka isikapa Wiindamekewinan che winjasek anishinaniwa tesonink mina Kiiwetinoong eskam nananska wamen Wiindamekewinan ka kwetsimekuyan kichi skuniugamek Kiiwetinoong kimangit oske mat Kiiwetinoong nempite utamawamen Wiindamekewinan oske anokiwinan hinangit ohowenene kakwetwewenene awia owik kendan kegina nanda kitapuwen an enentamawat awiyak huwenne nentonche tahtbatu tamen kaye kekunenan ka pemanukateken eskam ka anukataman kekun nentane kipitsemen nanda imatsek ninkakwetsmamen aneketotamank Wiindamekewinan pahpahkan apawineng piwinchiwak sagot kawan katat chikische og kendamawanawat mina chiki skoniwat ke inankiwat musag ne nanan tunawamen Wiindamekewinan pikanon shen kispen Wiindamekewinan andawendaman nengi unatomen kaye niana noyek ka nikan endamwat apawanak mina okwapawanak nepekamen kwatek miche mina menontigewen omama mina onichanishan kehte anshenani is Kiiwetinoong mina maskikewen Abadchikewapenewanan mina mamatunen chikan Wiindamekewinan mi owenawan ka nikanen ta kwaken anokiwinan ekintamank apawanak ekituwat Wiindamekewinan Wiindamekewinan chiki kihken chikate kwapan. Shaguch nintan nukatamen kekunan agwachiahi Wiindamekewinan kaki mehko tamang.
What about for specific projects? How is SLFNHA supporting community governance and research projects in practice? Ego iwanun kab mujgadegen nanandawi kendamoan IeehtaᒪŒᐃհnanan anin etujgadeg kab behbezigwaken kab mienkhwajgadegen ketchnaj ishkunganung ugmawen junendamwaj anin mayamgeniz mujgadeg nanandawi kendamoan gajgadeg kadawin demosnamna an etudamwaj an
That's a great question. Research is typically practiced and funded in a very top-down approach, meaning funders put out a call for a specific topic. Researchers, most often at universities, develop a project question and methods, and then ask a community if they want to be part of their project. Instead, SLFNHA is trying to understand community research interests, like having the 5 research priority areas, so that when there is a funding call for a topic that matches with an interest area, we can go, okay, I know what community is interested in that topic. Let me touch base with leadership and find out how they want to develop a project to propose. Then we can identify a research partner if we need more help that may have different skill sets than what we have here on staff. So that's step 1, having the community determine the topic or question to explore with research. Step 2 is that we then work with community leadership to figure out how we're going to do the research or collect the data. This is called the methods. We often hire someone local in the community to help advise and support data collection. There are many other details that happen at the beginning of a research project, like agreements or about data storage and access, that we do differently than others to ensure that community is prioritized in making research project decisions. Overall, we seek project direction from community and action what they want us to work on. This is fundamentally different than how research projects historically progressed.
Nanandaw kikenchigewan inahte minat bahigate ispemengahpenisiahi iziganawapan chigate okama okanutan ke anakatenik nanandaw kikenchigek kchishkuni ukameko otonawa kakwetwewan winan mina kene tochigatenik mina okakwetman apewanan kispin wawich tonigwen Otano Kiiwetinoong. They got Sioux First Nations Health Authority, Ukagwe Nesitotan, and Apewanan Esibagusenamunich. Tabiscoach, Niana Noyekagi, Tashinjagadegan. Kispin Sonia Pagatanens, and Senane Upagusenamoning, Mike Ikitoyang. Aha, ningi kendamen apewen ka mametunen tang hiwenne. Ninga kanona okemahkan an kese andaw wen tamewach kese matano katenak. Mitas kese onenemens ke witano ki mangit. Unanandaw kensige kispen andaw wen nemens. Bakan ga ieehtaᒪɁηnet ega nintano kinaganan kasi ieehtaᒪݹnet. Basic mitas hiwe nestam enduchigate. Apawanchi unintang kekunen kawi kakwetwenanuang. Nishin witano kimamen okemahkan che unen chikatek Anikawi to Chikatek Nananda Kenchigewan Nantake untin Nikatek IeehtaᒪɁηnan. Mi Asian Katek to Chikewan. Nintontenamen awiya ke wichihikoyank mamushakin namang ikatonan. Machina tinon ka anokatekin apin ka machi nanantaw kenchikatek. Tabskoch nakumituin winan nanda kese achikatekin ikatonan mina kese onchipichikatek ka tutamang pakana yek Kiiwetinoong apawin chinikan nasench ane onachikaniwa ni kanen takwan anukiwen chiwenche kano chikatek aneshenani kank mina chito tamang kasi andawen tamewach mi huma ese pahkanto chikatek nanandaw kenchikewen musa kagi pinapatak weskach.
I think that's an important piece of research. I've worked with different research groups, and I'm involved in some research projects here at SLFNHA. And I see how we're trying to make sure that community is involved in the health research projects that they're interested in, from the beginning to the end. Can you share some examples of either past or ongoing research projects that SLFNHA is working on? Ankyun mujgadeg nananda kendamon kanananda kenjgadeg akuziun ego keni nego ima bapkan as Wiindamekewinan kanananda kenjgadeg maujugo kchenkyun ego jigetnau nanung hag awyag ishkungangaun juaj ekendamoj ego chke mamin shkamoj and again is mujgadeg baniwan kun mauj kchinendawaniwa ego chke gan gamad chgadeg yuan kun ego chke kagis chgadeg gdawin demosnam naiwanun bangi gegunan adgewedu danang andabuge megajga kabmien khajgadeg niwanun nanandawik kendamonan and kun ahing SLFNHA.
Yeah, definitely. We have many different projects ongoing that cover many different topics, such as diabetes, virtual medicine or OTN, COVID-19, oral health, cardiovascular disease, tuberculosis, cancer screening, and many other topics. One project that we're working on is called Diabetes Connections. In this project, we work with leadership and health staff working in community to find out what is going well and what needs improvement when it comes to people accessing healthcare for diabetes. This could mean for testing, medication management, foot care, nutrition support, education, many other things. There's a lot of different elements of healthcare for diabetes. From this work, we are hoping to improve delivery of or access to healthcare for diabetes, supporting community efforts and advocacy for needed services, and improve the ways that current services work together to enhance patient experiences. This project's just beginning, and my coworker Amos will be working with communities this fall. If you want more information or you want to participate, you should definitely reach out to us anytime.
Kiiwetinoong dayamin machine ka pamanuh ka tamang anukiwinan kaye sugawa pinewan wasa ka winche wa pamint maskikiunane COVID-19 we bit andawihiwewan mitte hiya pinewan TB biwa bikuman choswa pinewan nanagachihiwewanan mina machine tashinchikanan Pesika anuka tamang shugawa pinewan sagishamowanan. Huma anukiwinan nawidanukimamen ogamakan mina akusiwi anukinaganak. Apawanan ewi kikin tamang Kegunen men segwen mina kegunen ega mensek awiaga andawen dang shogawa pinewen wichiwewenena kaijigate ke shogam che kuchihat ke maskikiman koyakche udapnaman ke sitan che kanawendaman ke wichigowan ke inanchikeyan shoga keken tamawan mina machine kegonan apich machine adenon keki keken taman keshi kanawen taman shogawa pinewan Wiindamekewinan nimpaggosendaamentuwinche wichiwewen nanda ke wenche tepenekatek sukawahpenewen wichiwewen wichigadek kanuchike tamagewen mina chewenche menusachikadek wichiwe wen awashame chemenu ayat udahkuzi Wiindamekewinan nongum mach chigate mina Wiindamekewinan emas ukag machi Wiindamekewinan abunan nongum ke tagwageng kispin kiabe wikkendaman nanda wistoyan beganon shin begwanapi.
That sounds interesting and important. I remember the SLFNHA report about diabetes in this region, and some of the data are pretty surprising. Other than health data, what are some outcomes from SLFNHA's research work? Mira maujugu kchinen dawan ego kchin dawan Wiindamekewinan ego ahin khendan winigo bezige ego amdama nahi suga apneun kagi nanagat chigadek kagi nanandawi kenjigadek ego maujugu eskam awya jiddanendangu inendawan yua kegunan ga menchigadek nima ankhuyun ego ts kegunenan gaya ka menchigadek kegunenan yuanun gadawin demosnam na kegunen yua.
Every project is different, but as one example, we worked with Children's Hospital of Eastern Ontario, or CHEO, Health Canada, Carleton University, and NAN to measure the quality of air inside homes in 4 communities, and then looked at how often young children living in these homes had lung-related issues, causing them to go to the nursing station or hospital. From this project, we were able to provide data and evidence that poor indoor air quality was causing poor lung health for children in forms of asthma or infections like pneumonia. NAN has been using these data to advocate for increased housing funding, and we worked with community housing managers to make improvements to the homes that they could at that time. We also created information cards for community members about things they could do to improve indoor air quality in their homes immediately. Another example is that we're currently working with Ontario Health on a project about colorectal cancer screening, also known as colon or bowel cancer. This is the most common type of cancer in this region, and we have very low screening rates. Screening is when people get a test to check for cancerous cells before they have any symptoms. So we are working with communities to get feedback as to why screening might be low and how we can create invitations for screening that are more appropriate or relevant for communities. So sometimes research projects result in published data, which can be used by funders, people advocating, or academics. But we also try to make sure projects result in materials or knowledge that community can use or directly benefit community members.
Kakina anokiwan bakanse. Basic awestigan. Nungi Wiindamekewinan apnon Jesus akusiwe gamik wapanong neke Health Canada Carleton kchiskuni gamik kayen snabesk nation ewi kentamang esi bagtanamo sangwen wakahigan nan niwen apuning mina che kanawapan tamang andasino apnon Jesus upagit panang Nanda Asia ya wa gwen chuwenche nache maskikwe wach nanda akusi ugamekong. Wiindamekewinan ninki undinamen kikendamawan mina ihnagwak. Ika kwayak pintigamen ka pagkitanamasang. Hakusish kaguwach apinontisak. Ipagkitanamowahpenewach. Nanda ikchi agigwahpenech. The Snabesk Nation obi abadstone kikendamawanan ikanochigihtamagich chi nankinemench wahka hike wisunyan. Mina Wiindamekewinan apuanak wakahige okimak kusewa wawich to wat. Niki otomen kaye Wiindamekewinan ansinenwake to tamawach meno pakitana mosenenek wakahigano wa shemak. Kutak awestigan megwats na Wiindamekewinan Ontario Health hanno katamang che nanaka che hinto awiyak unagziwang che biwa bekumash manichu suwach mikaye esik kinchikatek biwa bekumanichu suwa benewen mi huwe mawat misowe ka nagwak biwa bekumanichu suwa benewen huwe teneke mina mawat pangi nagwan nanagat hiwewen. Nanagat hiwewen ka itikatek awiya ka kutsinch kispinche nagwanenek biwa bekowe manichusan kikskawaj egamashika nagwanenek. Wiindamekewinan apawanak che Wiindamekewinan ninihe eka wenche zawat che nagat hinto mina anike innento che bisawat nawat kese besentamwat apunak eskam nananta wek kenchgewen masna hekanen is atikatewa ke winawa optipahikek che abachtuat okano chike tamakek nanta ogche kentamak keche skoni ugamekong ninka kwe kechna homen nintano kiiwetinoong che wichikoach apuanak nanta mayam che wichikoach ansinenwa.
That's really important, that research findings flow directly into action or education or something that communities can use. Miigwech, Ariel, this has been really informative. If a community is interested in connecting with you about research to learn more about participating in the Diabetes Connections project, or for information about being part of the Research Advisory Committee, how can they contact your team? Maujigua kchinendawan yue kawin jigadeg yuenun kendamonan kab kenjigadeg in yuene ankuyen gabu jigadeg ego ji abadakin ban ego chke awye kegun jigun chkendag ban ego chke anin ge dujigadeg ban pinj ishkun ganing yuenun kendamonan gajigadeg kchimigo chkenu area maujigua machine kegunan ka tadazindaman weed sewanun iwanun jimunyapan anshinuag ego anshinabeg ishunganangayat in Kiiwetinoong ego gisminawya weed studio anhyun anin geistigepan adga hi sugapaneon anhyun gajgadeg Diabetes Connections project anin geistigapan jiwid stopan awanenan ge ganunapan adga Research Advisory Committee gajgadeg iwe jiwid stoads awanenan ge ganunapan ansge gedudamapan jiwindamads widanhimguin.
Anyone can email us at research@slfna.com or call me anytime, 807-737-6069.
Begawya tabimasnahige research@slfna.com. Begwan pi nanda bigutun 807-737-6069.
And what about if people want to read some of the reports that have come from research work in the region? Where can they find them? ego gishpinoya awashmega bj week kendang jigi nananda wendang ban jigi kagwe we amstuj iwanun ga kagamin ga degin kendamonan anin ge dudang ban awanenan ge ganun happen iwanun jgatnang.
All of our past work is cataloged on our website, www.slfna.com/research. On the side menu, there's a heading called Project Library, and everything is listed there. If you can't find something specific that you're looking for, email me at research@slfna.com. Thanks for having me today, Charles.
Kakna kagi pi anukadamang maznahigadewan nintago Wiindamekewinan www.slfna.com/research. Opame hi bin to be abekagode project library kakna ke gon maznahigade hima gishpin ke gone gamikaman bimaznahamashin hima research@slfna.com. Charles.
So that concludes today's show. Thank you for tuning in to SLFNHA Radio Connect, where we are building strong connections with communities by sharing who we are, how we can help, and the services we offer. Connect with SLFNHA on our Facebook page or on our website at www.slfna.com. Miapanagiwa atibseg noom imaga Wiindamekewinan akwazio antkun gabmujgadig ima SLFNHA Radio Connect. Bawajibu aikid nanun ishunganan suidan kumanda anshinwagiga anshinabeg egotske anin gegizwichigo yamban iwa akwazio antkun gabmujgadig.
Recorded and produced at Wawatay Communications Society.